I know many are tired of hearing me say that COVID-19 is not over. Sometimes I'm tired of saying it. The truth is, though, that COVID-19 is still here. The number of active cases has now risen to 1,430. We continue to identify high numbers of cases across the province. We identified 110 new cases on Friday, 103 on Saturday, and 91 on Sunday. Currently, 88 people are in hospital, including 17 in intensive care. Sadly, I must report that 8 more Albertans have died. These deaths were all reported to Alberta Health since Friday, and all but one occurred in the last 4 days. This is obviously a heartbreaking number to report. We cannot forget that this virus can have severe and even fatal impacts on our health. I would like to extend my condolences to the family and friends of those who have lost loved ones, and my sympathies to those who have suffered severe complications during this pandemic. 5 of the deaths I'm reporting today occurred at the Good Samaritan Southgate Care Centre in Edmonton and were reported to Alberta Health over the weekend. There are now 78 cases linked to this outbreak, including 12 deaths. We are taking this outbreak very seriously. Local health officials have been working with the operator and have determined that additional supports are needed to protect residents and staff. As a result, late last week, Alberta Health Services took over day-to-day operations of the Southgate Care Centre. This move was not taken lightly, but will provide more supports to help improve outbreak control, ensure appropriate levels of staff are in place, as well as infection prevention and control measures to address the site's COVID-19 outbreak. I know that many families in and around Edmonton have been impacted by this outbreak. It is yet another example of COVID-19's ability to spread rapidly and of the devastating impact this virus can have on some of the most vulnerable members of our society. As we see in the case numbers, the curve is no longer flat in Alberta. We all need to assess our own lives for where we are at risk of spreading or contracting the virus. All of us can make changes to our daily routines to prevent the spread of COVID. For those who may be at higher risk of severe outcomes, we have created a new online risk assessment tool to help you identify your level of risk for severe outcomes and to guide your protection decisions. You'll find it on alberta.ca. This is something we have been asked for by Albertans who want to know which medical conditions are linked to the highest risk of severe outcomes. For everyone, independent of risk, if you are sick or concerned about being exposed, please get tested. For those who have been tested, many have asked if there is a quicker way to receive COVID-19 test results. There is good news on this front. Albertans can access their own health information through a secure online portal called My Health Records. This portal gives you a secure place to see your health information, including immunization records, prescribed medications, and lab test results, including COVID-19 test results. This is the fastest way to get your results as you can see them online as soon as they are available. I encourage Albertans to sign up for a free My Health Records account at alberta.ca/myhealthrecords. With the rise of cases in recent weeks, I know when I talk about statistics, we can forget that there are real people behind these numbers. It's important for us all to remember that these are real people who caught COVID-19 while simply living their lives. They went to gatherings at friends' houses for social connection, funerals to grieve the loss of loved ones, workplaces to support their families, and exercise classes for mental and physical health. There are powerful underpinnings to our actions that lead us to activities that provide benefits to us. People who catch COVID-19 aren't bad people, and at the same time, people who avoid COVID-19 exposure aren't fear-mongering. As much as possible, we need to support each other to meet our needs for human connection, meaningful employment, and access to basic requirements like food and shelter, while at the same time doing our best to also protect each other from the spread of infectious diseases like COVID.